Welcome back, everyone. Today I am here with my friend and colleague, Shawn Needham, who is also a fellow pharmacist who thinks outside the box, who doesn't get caught in the cycle of the we should do this just because it's protocol. So today we're going to play a little game of would you or would you not take this medication? Welcome, Shawn. How are you today?
I am doing wonderful, and thank you for having me on.
I'm so glad for you to be here. So let's dive in. I want to talk today. I love all of the clips that you're doing on your social media where you say, as a pharmacist, I would never take this medication, and then you describe why. I love it. I try to even mimic it in my own way to my own audience because if you don't know, you don't know. And as you do know, we as pharmacists over the years, we go through protocol where doctors prescribe prescriptions to patients. They take them, they don't have responses to them. They get caught in the cycle of more prescriptions,
Yeah.
treating one side effect with another prescription over and over. And really, it's like, why? Why are we taking these prescriptions? What are they actually doing to the body? How are they actually helping us get better? So, without further ado, let's dive in. Would you, as a pharmacist, I feel like I'm an MC.
You're doing a
This
great
is a
job.
this is a fun game. I'm like Bob Barker. Would you, as a pharmacist, ever take a statin medication if you were told that your cholesterol levels were high?
First of all, I want to say if you're Bob Barker, just don't try to kiss me, okay? All right. So, as a pharmacist, I would never, ever take a statin or recommend a statin. Statins are, used to lower cholesterol, and they are very effective, as you know, being a fellow pharmacist, at lowering cholesterol. And here's why I would never take a statin. First of all, their side effects, and let's just call them what they are so we don't water it down. Side effects is another name for toxicities. Drugs
100%.
are poisons,
Yes.
and those are just facts. We know that. We learned that in pharmacy school. So, side effects are actually toxicities. The drug is being toxic. And two of the biggest side effects or toxicities of statins are rhabdomyolysis, which rhabdomyolysis literally means rhabdo means striated, myo muscle lysis breakdown. So the breakdown of striated muscle. That's why people feel pain, they feel fatigued, they feel horrible, their muscles are sore when they're on statins. And they also cause hepatotoxicity. Hepatotoxicity is liver toxicity. People have died from the liver toxicity. We all know that. One of them was pulled off the market. Baycol was pulled off the market. That might have been before your time in
It
pharmacy
was
school.
it was
Yeah.
right around the time I think I was on rotation. It was like my last year of pharmacy school when it was pulled. Yep.
Yeah. And it was pulled because it was hepatotoxic. Some people had died from liver failure. I personally don't feel that any of them are any different. I think they're all just as dangerous as that one.
Agreed.
So now let's get into, are they effective? I did verify that they're effective for lowering cholesterol. Sure, they are. Are they effective at decreasing cardiovascular disease, heart attacks, and strokes? Well, let's just think rationally about this, okay? We get it. There's studies out there. I'll get into that a little bit later. But let's just think rationally about this. Statins have been out since 1987. Mevacor, lovastatin was the first statin to be out. They've been out almost 40 years, right? And cardiovascular disease is at an all-time high for Americans. They're not working. No matter what studies say, they're not working. And when you look at the studies of the statins, we have to go into relative risk versus absolute risk. They'll say, well, statins decrease the risk of cardiovascular disease by 50%. How do they get to that number? I'm going to use easy numbers because it's easy for me to do this math. I'm not a mathematician, I'm a pharmacist. So let's say there's 100 people in the placebo group and 100 people in the treatment group. So the treatment group gets statins, the placebo group gets nothing, they get placebo. And in the placebo group, two people have a heart attack. And these are pretty equivalent numbers because this is about what the numbers come out to when you look at the statin data. Two people in the placebo group, the non-treatment group, have a heart attack. One person in the treatment group, the statin group, doesn't have a heart or has a heart attack. So Two versus one heart attacks, 50% decrease in cardiovascular disease in heart attacks. Well, sure, relative risk, that's true. But out of the 100 people, it decreased one heart attack. It was a 1% risk reduction at best. And I don't even buy that, honestly. Because let's look at cholesterol. Cholesterol is ubiquitous in every cell in the body. We will die without cholesterol. That is a fact. Our brains are full of cholesterol. Every cell membrane has cholesterol backbone, okay? Our hormones, or especially our sex hormones, are made from a cholesterol backbone. Vitamin D has cholesterol, for instance. All those things we would die without, okay? But let's look at it this way. Let's think about how we vilified cholesterol, okay? So 80% of our cholesterol is made up in the liver. Our liver produces 80% of the cholesterol. It's not from what we eat. It's not from saturated fat like we've been told. Well, we do get cholesterol from that. That's not necessarily bad, but most of the cholesterol is made up in our body. So you're telling me that our body is designed to make 80% of the cholesterol and it's bad for us. Doesn't make sense. A
Not at
chicken egg,
all.
a
Yes.
chicken egg, the yolk of a chicken egg is mostly cholesterol. And you're telling me that's bad. That's going to sustain a baby chicken. And you're telling me it's bad. I'm not buying it. Not buying it at all.
Me neither. And I always like to try to explain it to people in this sense where, like the root cause sense of like cholesterol actually is kind of like the hero when you think about it, right? Like it's kind of like when we have damaged vessels, thin vessels, inflamed vessels, and that's going on from poor dietary choices, poor, sedentary lifestyles, just overall not doing the healthy things. And then these vessels start to thin. This is where the cholesterol goes to kind of patch up the vessels. It kind of comes in as the hero, like the firefighter putting out the fire to patch those vessels. But this is when the cholesterol levels increase, and it's almost like yes, we don't want the cholesterol there, but it's not like cholesterol's the bad guy. We want to decrease the inflammation and live the healthy lifestyle to make sure our vessels are healthy, strong, and doing what they need to do.
Yeah, absolutely. I mean, what has changed? What's the biggest change that we've had over the last 40 years with Americans that could be contributed to cardiovascular disease? I mean, the facts of the matter are, Courtney, is it's obesity.
Yep,
Um,
absolutely. Our diet,
you,
nutrition.
it
Yep.
makes no sense to me whatsoever that somebody can be 100 pounds overweight, you give them a statin, and you decrease their cardiovascular risk. I'm not buying it whatsoever.
Me neither. Not even a little.
And I think honestly, what we're doing is just malpractice. You need to tell people you need to lose weight or you're going to die of a heart attack.
Yep. And you know what? This kind of transitions us into, drug number two and, talking about drugs for type 2 diabetes. And this is just one that almost kind of angers me. I once was working at a pharmacy and the technician who had type 2 diabetes. Her A1C was off. She was a little overweight. She worked really hard. She started walking every day. She started eating right. She got her A1C in check. She was great. She was the picture of health. She was doing all the right things. And on her lunch break, she went to the doctor and she came back with a script for Zocor. And I was like, Karen, I'm like, why do you have, I'm like, your cholesterol, I'm like, really? You're doing all the right things. I'm like, your cholesterol's high? I'm like, what's going on? And she said, no, no. She said, I just turned whatever age she had turned. And she said, the doctor had told her that it was protocol since she had a prior type 2 diabetes diagnosis, that it was protocol for her to put her on that statin because of her age and her type 2 diabetes that she technically reversed because it's not even a real disease. So she basically like was starting this statin and didn't even have high cholesterol because this doctor put her on it because of protocol and told her that she was liable if she had a cardiovascular event and she didn't offer her and recommend to her to take the statin.
Yep, that's what we call standard of care these days. And standard of care is created by, and pushed by big pharma. Those are facts. Big pharma funds medical schools, funds pharmacy schools. Big pharma colludes with insurance companies to create a formulary and the standard of care. And they, excuse me, they look at people's histories based on EMR and based on diagnosis codes and based on age, all that stuff. And if you're not on XYZ drug, then it sends them a note to prescribe that drug to remind them to do that. And the doctors do get incentivized. They get paid a higher percentage of reimbursement if enough of their patients are following those protocols.
A
Those are
hundred
facts.
percent. And if they do it in a faster, and if they see enough patients in a faster amount of time too, which is
Well, for
another
sure. Absolutely. Yeah.
disgraceful situation. Another topic for another day. But let's talk about type 2 diabetes medications. Let's talk about metformin. Like, do you think that people have this metformin deficiency when they get diagnosed with type 2 diabetes? Like, what's that about?
Absolutely not. They do not have a metformin deficiency. What caused the diabetes? Let's face it, what caused the diabetes? Mostly their eating habits caused the diabetes. That also means that you can reverse the diabetes with eating habits. And if you have a doctor that tells you you can't, get a new doctor. Let's talk about what diabetes mellitus really is, because that's what diabetes, sugar diabetes is. Diabetes mellitus, there's type 1, there's type 2. Type 1 is usually you lack insulin. Type 2, which means you usually probably do need insulin. But type 2 diabetes is usually later in life, although we're seeing it younger in life because so many kids now eat like crap. Um, is caused by, so diabetes mellitus literally means honey siphon in Greek. It literally means you are urinating out sugar.
I didn't
So
know
how do
that.
you
Fun
stop?
fact of the day. Whoa.
Yeah,
Knowledge
yeah.
bomb. Whoa.
So how do you stop from urinating out sugar? You stop eating sugar. Okay. So go low carb, eat good food, eat high protein, real food. None of these protein drinks and crap like that. None of there's a lot of sugar in them usually, but that's junk food. Eat real food, and you can reverse your diabetes. You do not lack a medication. Um, I call it this, and this is where I trigger some people. You don't have type 2 diabetes, you have hyperactive fork syndrome. Okay. That's really what it is. You are eating too much, put the fork down and start exercising. Um, one of the ways to burn glucose is start exercising, just walking, whatever. You will burn that glucose. You're not meant to be storing that stuff all the time because we are good at storing stuff. We're good at storing energy around our waist as fat for energy later. Another way is to fast. If you don't believe type 2 diabetes is reversible, fast for 24 hours. Please don't do that if you're on insulin, or be very careful doing it. Fast for 24 hours and see what happens to your glucose. And tell me type 2 diabetes isn't reversible because your blood glucose will come down. I would almost guarantee it.
Absolutely. And it's even like the example that I just used. My tech, who literally, when she was told that her A1C was off and she was diagnosed, and she got down to business and she just made her lifestyle changes. She started eating right. She started to get moving, walking every day. She just made the little changes that got her A1C down. And I mean, in my opinion, you're not even really diagnosed with the disease at that point. She got her numbers in check where they needed to be. And at that point, like, it's not a disease. You're living a healthy lifestyle. You're choosing to be healthy, and 100% reversible.
Absolutely. Absolutely. It's a dietary problem is what diabetes is, type 2 diabetes is.
All right, let's talk about proton pump inhibitors for reflux disease. So, your omeprazoles, Prilosec, your pantoprazole, Protonix, those guys. Let's talk about those. If you're feeling a little bit of heartburn, what are you doing? Are you going to be popping your omeprazole and staying on it for 30 years like I
A-
see my patients?
Absolutely not. Absolutely not. And now I will say this too, Courtney. When I talk about most of these drugs, I mean, drugs can be good and can be used in certain acute situations,
Agreed.
short term. And actually, the proton pump inhibitors, they're indicated for short term. They're indicated for 6 weeks. They're not indicated for 20 years.
They
Okay.
absolutely are, and can be very helpful for somebody who develops some kind of peptic ulcer or needs something for an acute basis. There's an infection or something where we need to calm that down. We don't want this to turn into something bigger, God forbid, a cancer or something. So yes, it does absolutely serve a purpose, but long term, when we look about it, all of the side effects that it can cause, decreasing stomach acid, in turn, what's happening when people are taking these proton pump inhibitors for long term?
Well, that's just it. So our bodies are created, our stomach is created to be acidic.
Right.
And so when we take a proton pump inhibitor, which is a strong antacid for simple explanation, it decreases the stomach acid production. What does the stomach acid production do? Stomach acid production stops bad things from entering into our body, bad bacteria, bad viruses, many different things. It also, will dissolve things. So it will chemically dissolve our food so we can absorb nutrients. Okay. Um, so it's gonna disrupt our microbiome, our good bacteria in our body, in our GI tract, and then it's gonna um, make it so we can't absorb nutrients, especially vitamin D, calcium, things that are hard to dissolve in just water alone. It
100%. And then just pause right there. So, just for our listeners, when we're talking about malabsorption and okay, now we're messing with the gut microbiome, we're messing with our stomach acid, now we're not absorbing the nutrients we need to live healthy lifestyles. Now, looking at the big picture, which we don't, this is the part, the gap where people don't recognize is what is that doing to our hormones? What is that doing to our energy levels, our weight, our libido, all of the things down the list when we're shifting that microbiome and we're causing now the symptoms because we're not absorbing the nutrients we need to live a healthy life. Okay, continue. I'm sorry.
Absolutely. I mean, we're screwing up our microbiome, which will screw up our neurotransmitters,
Yep.
which will make us feel like crap. Screw up our immune system because our immune system is in our gut, but and then like vitamin D and calcium, for instance, that's what helps us make strong bones, right? But then we get then the people get osteoporosis, but we have a drug for that, Courtney. We'll just give them a drug for that. I mean,
Right.
you can't make it up.
It's true.
So
And I
so the
think that
reality of it is, anytime we have a gut problem, whether it be reflux, acid reflux, too much acid in our stomach. Um, it's a dietary issue, and I will tell you, I'll give myself as an example. Before I lost 60 pounds, I was obese 15 years ago, and I lost 60 pounds. And before I did that, I would wake up every morning with reflux. Um, After I lost weight, my reflux went away. And I never really took anything for it because as a pharmacist, I don't believe in taking drugs long term, even when I was, and that's one of the reasons I made changes because I I knew I was going down the road of diabetes, hypertension, all that kind of stuff. I didn't want to be that person with a med list of 20 different medications because I've seen what it's done to people.
yep, 100%.
So and I will tell you this, I still, I fall off the wagon and eat like crap more often than I should. And I pay for it. I'll get reflux the next day. And it's like, well, I better not do that again. It's just a reminder why not to do that. So change your diet and that reflux will go away. And the problem with those proton pump inhibitors long term is what happens is our GI tract has a mucosal lining. The mucosal lining is there to protect our stomachs from being eaten away, literally. And when that mucosal lining goes away, like in an ulcer, it's very, very painful. One of the things that acid does is it stimulates that mucosal lining to get thicker. It's like, oh, wait a minute, we've got a lot of acid in the stomach, which is a good thing. Um, so I'm going to thicken that lining to protect the stomach from being eaten away from the acid. Well, when you're on long-term antacids, that lining gets thinner and says, oh, well, there's not a lot of acid around, so I can get thinner. The problem is you stop taking the medication, you get rebound reflux because all of a sudden you've got a lot of stomach pain because you've got a thin lining and a bunch of acid produced. And then it's hard to get off them. So you have to taper off of them. And you know as well as I do, Courtney, when you've helped patients get off of them, it is very, very difficult. And honestly, Courtney, I think it's all by design. The drug companies know it. They know that once you're on this drug, you're going to be on it for life, and doctors just keep prescribing it. And unfortunately, most pharmacists aren't like you and I to educate people about the dangers of them.
I know. I fill in at the pharmacy still every now and again. I actually am here now and I have a consultation with somebody this afternoon. I was here last week and I'm getting him, I have a taper schedule for him and I have my four favorite supplements that I do to support the
Yep.
gut and help come off of that, when you're having that hyperacid secretion, how to kind of counterbalance it as you taper off. So I'm actually doing that protocol today with somebody because yeah, it's the people that want to get off and it's the cycle. When you try to stop it, it gets worse. So Yeah, so and then even taking it back to the part of malabsorption, which kind of leads us to our next medication. When we talk about malabsorption and osteoporosis and the things that maybe we might not see right here and now in the moment, but years down the line, I always say to people, when we're in our 40s, if we don't balance our hormones and our estrogen, if as women we don't take care of our perimenopausal symptoms when we're in our 40s, it's all fun and games until we're 60 and we like shatter a hip closing the car door because we're not absorbing what we need to do. And it's not that it's a deficiency, it's our estrogen levels cause that depletion of our bones, and then it becomes a problem later in life, which leads us to birth control pills. I'm sure you would never take a birth control pill for any reason
No, I never
whatsoever
would.
at all. But if you were a woman and your doctor wanted to put you on a birth control pill to control your cycle, your menstrual pains, your endometriosis, your PCOS, and said, "Oh, here, take this. It will regulate your cycle." What would you say if you were if you were a lady?
Absolutely not. I would never recommend birth control pills for any woman. And here's the reason why. So Janet and I are we specialize in hormone replacement. So we specialize in bioidentical hormone replacement, and we help women and men all over the nation to optimize their health through hormones. And we see the damage. Many times we see it years later, when a woman is in her 40s and she's been on birth control for 20 years, and we see how it has messed up her body. Yeah, I mean, and in the younger years, when they first start them, what happens? They get depressed. Oh, well, we'll just give you Prozac. You lack Prozac now, so we'll give you Prozac. Then they get bipolar, and then they get psychotic, and then they can't sleep, so they give them medication for sleep. So they're on 5 medications because of the side effects of birth control pills. It's horrible, and literally, what birth control pills do is they suppress your own endogenous production of hormones. So they shut your ovaries off from making hormones, estrogen, progesterone, testosterone, right? They literally put you in early menopause is what they do. And what does that do? What do our hormones do? Makes our bones strong, makes our heart strong, makes our brain strong. I mean, they do so many things. So over the period of many years, these destroy the body. And I think that's why a lot of women heart attacks are up, cancer's up. I mean, there's other factors too, but osteoporosis is up. So I
Yeah.
would never ever recommend birth control pills. And here's the thing: fix the problem. Don't just treat the symptom. Oh well, this gal's having irregular periods. She's 16 years old. She's having irregular periods, or she's having PMS. It's like, okay, well, what is she lacking? Um, First of all, look at dietary issues. Is she eating well? Our body does not like to reproduce when we're not healthy. Those are facts. So whether we're men or women, if we're sedentary and we're not eating well, we're not going to have high hormone levels to be healthy, because our body's going to say, you know what? Screw this. This guy's drinking beer and eating Cheetos all day long. I'm going to make his testosterone go down because he's sedentary. He doesn't need to have sex. And do the same thing with women. So when women have PCOS, many times it's a dietary issue,
Metabolic,
and
100%.
really what they lack progesterone, and
Yes.
progesterone is not the same as synthetic progestins that are in birth control pills. They're completely different. So we deal with this all the time at our pharmacy, and progesterone is a treatment, not birth control pills. And by the way, there's kind of a joke in women's health, but it's not a joke, it's serious. If you're under 40 and you have any kind of hormone related issues, let's give them birth control pills. If you're over 40, give them a hysterectomy. That's really how it works.
Yeah, so let's talk about this for a second. And I also want to say that this topic is fascinating, and I would like to have this conversation with you and Janet on a podcast coming soon, dot dot dot, for those listening. But this was me. Everything that you just said, Shawn, it was me. I was from the age of when I got my cycle and started with painful periods, and I would go and they were irregular and they were heavy. And was diagnosed with endometriosis I think I was probably 15 or 16 years old. And immediately put me on birth control pills to regulate my cycle. And looking back and looking at all of the different things that I was exposed to and had, and then the anxiety came, and then I was on, so I was brand Zoloft years old. They put me on Zoloft back then. I was on an antidepressant for 16 years, and I know we've had this conversation on a podcast before. It's
Mhm.
kind of like when I kind of decided to take control of my health. But exactly what you just said, it started out with let's regulate it, then it turned into anxiety, but then I had chronic constipation and reflux. And the next thing I knew, I wasn't even 20, and I think I was on 4 different prescription medications
Yep.
while I was like in pharmacy school. But again, as I was going through it, I was learning it, and I was like, oh, well, okay, I'm learning how to treat that. I can go ahead and throw that on board and
Yep.
whatever. And you know how it led to different things, like wishing that I knew what I know now then, you know, with all of my struggles with infertility and just weight and energy levels and brain fog, and realizing that when I was 40, exactly what you just said, well, let's just let's just do maybe a hysterectomy. It probably won't even solve the whole endometriosis problem, but we can see. And that was when I was like, pump the brakes, I'm done with this. And I started to hone in on my nutrition. I started to hone in on my stress levels. I realized my exposure to mold toxicity, how much that affected all of these things. And I'm a completely different person than I was 4 years ago, who they were going to remove literally several organs because of my whole life struggling with this. And you just nailed it. You just literally, not even knowing my story, you just nailed it and said everything, every step along the way. Before
And,
40, birth control pills; after 40, hysterectomy. And I was like, mm-mm.
right. And although you are very unique in yourself, Courtney, your story is not unique. And that's why I know it, because we hear it every day. And you know, I'm for I'm for preserving body parts. You know, so many unnecessary hysterectomies go on out there. And you mentioned the infertility part. And I didn't mention that, but it's of course birth control pills cause infertility. I mean, they stop you from being fertile, and many women after the fact can't get pregnant. And it depends on the birth control you're on. And by the way, when we're speaking of birth control pills, I want to make this clear that it's all hormonal birth control. So Marina IUD, I think, is even worse because it's implanted for years and just releasing hormones. At least birth control pills, you can stop taking them, and within a few months, you should be okay. I've seen people with Depo-Provera shots that for years they have side effects, breakthrough bleeding, all that kind of stuff. Do they still make Implanon?
I
You
don't
know?
think so. I haven't. I don't think that they do. I don't
Okay, well,
think
that was an
so.
implanted birth control pill, and you know it was great because you insert it and it just releases for 5 years. Think about that, ladies.
I haven't
You've
seen
got
what
a
they
foreign
do.
object in your body releasing poison for 5 years. No,
Exactly.
thank you. Same thing with the Marina IUD. They say, oh, it's so convenient. Sure, it's convenient, but it's also poison that's being released in your body for years at a time. Um, and one of the things is too, and you may have experienced this, Courtney, but we see this all the time too. Is I get calls from doctors all the time. Hey, I've got this 20. She's got low libido. I just checked her testosterone. Her testosterone's in the toilet. I said, oh, 25. Okay. Is she on anything? Yeah, she's on birth control. I'm like, then get her off birth control. Well, she
Right?
can't. Well, okay. Then tell her not. Then she's going to be sick all the time. And she's going to feel like crap. It's just like there is no, in my opinion, it's a waste of time, money, and resources to check your hormone levels when you're on birth control, because the birth control is what's screwing up your hormones.
It
Get
is
off the birth control, call me, check their levels, call me in 3 months,
a
and then I'll
hundred
help you do
percent.
something.
Yes, it's going to be a fake level. Exactly. So, yes, birth
And
control.
let me just because I'm passionate about hormones, let me just reiterate about the infertility and or the decreased libido.
Yes.
So birth control pills decrease production of um, testosterone, and women have testosterone also, just not as much as men. And testosterone is not just good for libido, but it is good for that. But it's good for strong bones. There's no better drug for building bone than testosterone. It's good for our brains. It makes us feel better. So these are why birth control pills are so horrible. Never, never, never take them.
Agreed, 100%. And I wish I would have known these things back in the day because I was victim to it for a very long time. And it was even interesting to see. I mean, some of these specialists. I mean, I remember this specialist from University of Pennsylvania, this top doc, blah blah blah, that I was going to for my endometriosis. And I remember at one point it was like, okay, well, surgery. Like I wasn't getting relief from the surgery. And he literally said to me, I don't understand why all these doctors put women on birth control pills for endometriosis because endometriosis like grows off of estrogen. It doesn't make sense to me. And then after, he was like, okay, you're not a candidate for surgery. Let's do a D&C. He had some other stuff, whatever. But at the end of the day, when I was like, I'm still feeling what I was feeling, guess what he did? He put me on the birth control pill.
Yeah, yeah, yeah. Because that's standard.
And I'm
That's
like,
yeah,
didn't
right.
didn't you a
Yeah.
month ago just say to me that you didn't understand why doctors? It's like when they don't have an answer, birth control pill, and it's maddening. So, I 100% agree with you on that. And like I said, I had, I mean, again, it affected my fertility. I do have my son, but I was never able to get pregnant again with all that I tried. So I was definitely affected by fertility from, I believe, being on the birth control pills and affecting my endometriosis over the years. So
I look at it like this because my wife took them too. She didn't, that we know of, didn't have any necessarily side effects, although both of our sons were conceived when she was on birth control. Yeah,
that's
right. And
awesome.
I mean, obviously it worked out perfectly, but just to let you get ladies know, they're not 100% effective.
No,
And one of the things is that actually birth control pills might treat the symptoms initially, but it makes the problem worse because you're not producing enough hormones. And then, with your endometriosis, you're not producing enough progesterone. With PCOS, you're not producing enough progesterone. And you take birth control pills and it decreases the production even worse.
exactly.
So it causes short term, it might help. Long term, makes it worse.
It never, ever, ever, ever helped me, but it was the only solution that anybody had. So it felt like I had to do something to,
Yeah.
I felt like I had to do something to fix the situation. And that was the only answer that people gave me. So as much as I was on it, I'm like, I would go on and off because I'd be like, this isn't helping me. I feel like garbage. And then I'd stop it for months and then my period would be out of whack. And then it was like, all right, I'm just going to go back on it. But it was a very long process from when I was a young girl who I wasn't even sexually active, was just on birth control pills to regulate. And it was something that went on until I decided in my late 30s, probably right before I was 40, that I was like, I'm done with this. And that was when I really just changed my whole outlook on health and wellness and my career as a pharmacist. So it all kind of circled back around.
It does. And you know what, Courtney, you can use this to share your story. I mean, Jan and I have a story as pharmacists too about what made us open our eyes up.
Yep.
And we did some things that we probably that you know I, we dispensed statins to people and things like we believed in a lot of other things that we were told, but it allows, it's a powerful story when you get turned around, people are like, wow, a pharmacist talking like this, okay.
Yes. All right. Our last drug of the day, and then we'll have part two of this to be continued. But our last drug of the day, if you were told that you had high blood pressure, what would you do? Would you immediately start the medication or two or sometimes three that doctors put you on to control blood pressure?
So let's talk about blood pressure. So first of all, long term, I would never recommend a high blood pressure drug. Now, short term, if your blood pressure is super high, you don't want to have a stroke. I agree with that. So you might need to be on medication short term.
Yep.
But long term, what is causing high blood pressure or hypertension? So it's a metabolic problem. Okay. So your blood pressure, your vessels clamp down in order to make your blood pressure higher. And they do that to get blood into your extremities. Okay. So it's got to increase the pressure to get blood in your extremities. Now, why is it harder to get blood into why is it all of a sudden harder to get blood into your extremities? Well, when your body is bigger
I was going to
and
say,
you're
wait.
overweight and your
Yep.
heart isn't strong enough,
Yep.
the only way to get there is increase the pressure by tightening down the vessels. So, but long term that can cause all kinds of problems. Hypertension is definitely a problem and a risk for cardiovascular disease. There is no doubt about it. But the best way to lower your blood pressure is, and you're going to hear this again over and over if you follow me, is it's a metabolic disease. So lose weight. If you're overweight, lose weight. Eat right and exercise. So if you have a strong heart, that is a strong pump. The way you make your heart a stronger pump is you exercise, and that will help you circulate blood a lot better, and you won't need to have the clamped down vessels. So this is why being ideal body weight, I should say ideal body composition, and exercising is important. So diet and nutrition and exercise are important for this reason.
I,
So I almost guarantee people, if you lose weight, your blood pressure will go down. There's
I
exceptions to that rule, but here's another thing I would guarantee him. Because there's some skinny people that have high blood pressure,
that was
but
my
they're not active.
yes. Yeah.
And I say, you know what? You start exercising, your heart will get stronger and your blood pressure will go down. Those are probably just facts.
No,
Uh,
right. And that was kind of what I was going to say. Like kind of almost was an unfair drug topic to kind of throw out because I feel like it's half and half. Like are we saying as pharmacists don't take blood pressure medication in an acute situation where no, sometimes it's necessary. But looking at it as a maintenance situation of you're told you have blood pressure, the first thing you want to do is look at lifestyle instead of jumping to medications like you said looking at your weight and your body composition. Most people are overweight that are told they have high blood pressure. Looking at their lifestyle, sedentary lifestyle, what are they doing to keep active? What types of foods are they eating? Even if they're not overweight, are they eating processed junk food
yeah.
that's causing toxins to build up in the body and cause an imbalance in minerals and nutrients and all of that? This is all our minerals are our spark plugs of our body. If you are not nurturing them and nurturing, like we just said, the gut and all of that's out of whack, nothing else can be in whack if you're doing the things that are throwing it off, whether it's being on another medication that's causing you to be on blood pressure medication. Getting stress levels under control is another big one too that can increase blood pressure. So kind of a loaded question where yes, if it's a situation that you should talk to your doctor about, if it's an acute situation, but generally speaking, when it comes to the overuse and overprescribing of high blood pressure medications, most of the time, if you get your lifestyle factors in check, you can absolutely reverse high blood pressure and live a very healthy life.
And I'm going to say this about talking to your doctor. If you talk to your doctor and they give you some kind of answer like, oh, it's just genetics, probably, there's nothing to do about it, get a new doctor.
Agreed.
Here's another thing, too. I'm going to say this, and I'm going to get some haters out there.
It's okay.
But if your doctor is not metabolically healthy themselves and they're prescribing these drugs and they're telling you that exercise and diet and your lifestyle aren't going to fix it, and your doctor's overweight, obese, doesn't look healthy, get a new doctor. I'm just saying. You don't want to. Would you trust a dentist with yellow, crooked teeth?
No.
No. The answer is no. You'd walk out immediately. If you went to a dentist and the dentist had yellow, crooked teeth, you'd say, this guy is not going to help. I'm not going to go to this guy. Same thing with a doctor. Choose your doctors wisely. So, Courtney, I know you said this is the last drug, but we skipped over the osteoporosis. We just barely hit it. Can we hit them really quick?
Yes, hit it.
Okay, osteoporosis drugs. So there's three classes of osteoporosis drugs: the biphosphonates, like the Fosamax, the Actonel. Courtney can help me with these because I don't know about this stuff anymore because I don't keep up with it.
I don't
Um,
either because they're garbage and I would never.
yeah, exactly. That's why it's like when somebody says, what do you think about the latest, greatest XYZ type 2 diabetes drug? I don't know about it. All I know is type 2 diabetes drugs are not necessary. That's all I know.
I
And
think
I'm
I
not going to
was
research it. I'm just saying.
Listen, walking away
Right.
in August, I do my fill-ins here and there, but when it comes down to the new, I don't even choose. I'm educating myself on all the good stuff that people can do in the functional space.
Right.
Like, come see me about that stuff.
Exactly. And just to reiterate this for your listeners and viewers, this is what we're talking about, people. There's no great miracle drug out there, and there's not going to be one. Every once in a while, there might be something for an acute disease, maybe like an antibiotic or something. For acute infection, infections are a disease. So, but most of the drugs that come out are for diseases that are lifestyle created. So think about that before you take a new drug. No matter what we're talking about with just the few we're talking about today, Think about it with all of them, because eczema, arthritis, psoriasis can be reversed with your lifestyle. Seriously, we hear it all the time. Okay,
Oh,
biphosphonates, Actonel, Fosamax, um, indicated for osteoporosis. The problem with them is they can cause piloesophagitis. We know that they can get stuck in your throat and eat a hole in your throat. But not only that, but we do know that they increase your bone density. We know that from based on T scores from DEXA scans. Okay, so they increase your bone density. But here's the problem: that one of the reasons DEXA scans came out is because a drug company wanted to know it, make a number up where they could move the needle, and they found these drugs and the bone density. Well, just because your bones are denser doesn't mean they're stronger.
nope.
And that's part of the problem is it makes weak bones. And there's a side effect called osteonecrosis.
Yeah.
Osteo meaning bone, necrosis meaning death. It's literally causes the bones to be weak and they can shatter. If you don't believe this, don't trust me. When you go to a dentist and they ask, are you on XYZ drug, Fosamax or Actonel? Oh, yes. Okay. Well, we can't pull your teeth because we noticed when we were pulling people's teeth with these drugs, they were shattering their jaws.
Yep.
Well, our jawbone is no different than our hip bone.
Nope.
Okay. So it's going to make a weak hip bone too. Um, then they came out with Prolia and Forteo. Um, and those are two classes of drugs that that are indicated for osteoporosis also. Now, I can't remember, I get them mixed up because again, I don't keep track of the details. Because I don't believe in them anyway. One of those drugs causes osteonecrosis also. The other one, you can't make this up. The other one works on parathyroid hormone. I think it's Prolia, right?
I believe you are correct.
Right.
Yes.
And because these drugs are causing osteonecrosis, people caught on to this. So what did drug companies do? Well, let's create a drug that makes your bones stronger and can treat osteonecrosis. You can't make this up. So put them on a biphosphonate like Actonel or a Fosamax. They get their bones to increase the bone density, and then they get osteonecrosis. But hey doc, look at this. We got a new drug to treat osteonecrosis, and it'll make their bones stronger too. I mean, you can't make it up. So,
Nope.
but those three classes of drugs, what are they all indicated for? They are indicated for post-menopausal women. All three of those drugs. Postmenopausal women do not lack Fosamax. They do not lack Prolia or Forteo.
Pick me. I know what it is.
They what is it? They lack hormones.
Yes.
And when I say hormones, I mean estradiol, I mean progesterone, and I mean testosterone. There is no better bone building hormone or drug on the market ever that will build bone better than testosterone. And the reason I say that is men get osteoporosis also. It's not from lack of estrogen, it's from lack of testosterone. Testosterone is an anabolic hormone, it builds tissue, muscle, including bone. There we go.
100%. And that's the biggest takeaway. It's knowing what the actual deficiencies are and being proactive, because this is what I stress to people. This is what I stress to the perimenopausal ladies out there, just because it's the issue. Like, this is the time now that you need to handle the situation so that you don't have your problem when you're in your 60s with bone density, that you're making sure you're balancing your hormones and treating your hormone deficiencies and your gut issues and your liver and everything with care. Because if you don't take care of it now in your 40s, then you're setting yourself up for disaster later in life.
Absolutely. And I do want to say as we wrap this up, Cordy, first of all, thank you so much for having me on.
So well, thank you for being on
So
and for all your awesome knowledge.
you're welcome. So Jan and I have started a series where we talk about this. The reason Courtney's having us on is because we had a few videos go viral on Instagram. One of the videos got 3.1 million views and still going. One of them's got 1.3 million views. And it's basically on drugs as a pharmacist I would not take. So we've got a whole series coming up and we release them every day. And so go follow us on Instagram, Health Solutions with Shawn and Janet Needham, our Instagram account, and look at the drugs and why we state about what things we wouldn't take. We also have a few videos on things we would take as a pharmacist. Because we do believe in drugs acutely. They have saved lives. There's no doubt about it. But
Absolutely.
ultimately, we want to help, people fix people's problems, not just treat symptoms with drugs.
100%. I love it. I love your mission, both you and Janet, and you guys are just the best. My favorite pharmacist power couple.
Thank you so
And
much for the kind words.
of course, and yes, stay tuned, listeners, because we will do part two of drugs we would never recommend as pharmacists coming soon. Thank you so much, Shawn, for being on today, and I look forward to chatting with you again soon.
Thank you so much, Courtney.
Have a wonderful day.